salud. Yo soy Silvana Luciani, la jefe de la Unidad de Enfermedades No Transmisibles aquí en la OPS en Washington, D.C. y es un gusto darles la bienvenida a este webinar. Tenemos traducción simultánea hoy día porque el webinar será en inglés, en español y tenemos traducción en tres idiomas, español, inglés y portugués. Así que solo hay que elegir tu idioma en la parte en el Zoom donde dice interpretación. Good morning and welcome to the PAHO webinar. Today, I'm Silvana Luciani, the Unit Chief for Non-Communicable Diseases in PAHO, Washington, D.C., and it gives me great pleasure to welcome you to our webinar today, which will be in Spanish as well as English and Portuguese, and we have simultaneous translation in all three languages. You simply need to select your language of choice using the interpretation button below. And we really want this session to be as interactive as possible. So please include your name, your organization in the chat, ask your questions in the Q&A session, add your comments. We really want this to be a very inclusive and participatory session with all of you. Buenos, hoy día en este webinar estamos enfocándonos en la promoción de la salud, en el
Today, this webinar focuses in the promotion of health as part of the non-communicable diseases, and this is a part of a certifiable webinars as part of the PAHO's program on non-communicable diseases as part of the formative itinerary. This is the fifth seminar and the last of the certifiable webinars, and we're focusing on the promotion of health, but we have had already 4 other webinars that focus on the health determinants, risk factors for NCDs and clinical management of NCDs. So we invite you to review all the prior webinars in this series of certifiable webinars. And to obtain a certification, you must register for the complete 5 webinars and complete the evaluation forms. So we invite you to register, and in the chat, you will have the link to connect to all the other webinars so that you complete the complete series. Today, we're going to reflect on the measures to include health promotion as a cornerstone in the response to NCDs in primary health care. We will also launch a new course on community health promoters that is part of our Better Health Care Initiative training seminars. We hope that you will be learning lots in regards of health promotion, and with the new course that we're launching today for our health workers. And to launch this webinar, to open this webinar, we're going to invite Dr. Anselm Hennings, Director of the NCDs Department and Mental Health, and Dr. Jerry Hymans, who heads the social and environmental determinants for health equities, to open the seminar. They cannot be in presence with us, but they have sent a welcoming video. Yes, I'm going to share Dr. Henning's webinar video. Excuse me.
Muy buenos días a todas y todos.
Good morning, everybody. It is really an honor to welcome you to the last webinar of our certifiable webinars of the training sessions on NCDs. This session is called the cooperation between the NCDs Department and Mental Health and the Social and Environmental Determinants Department for Health Equity in the framework of the Better Health Care for NCDs to accelerate actions in primary health care. The objective is to strengthen the integration of health promotion in the response to
aportando
primary health care to people by encompassing several approaches on a community reach and with an equity approach. The initiative seeks to expand access to quality services in the community from a equity perspective to improve prevention, diagnosis, and treatment from a community approach and with a special attention to the most
Ahora hablaré en inglés.
to the underprivileged communities.
We will present a new training program for community health workers. These workers are key members of interprofessional health teams, acting as a link between the health center, the local area, and the community. Their inclusion in primary health care interprofessional teams contributes to more equitable, person-centered care that is grounded in the needs of the local area. Today, we're launching the self-paced online course, Community Health Workers for Improved Care of Non-Communicable Diseases, designed to strengthen the capacity to provide comprehensive care for people with NCDs, addressing risk factors and social determinants from a primary healthcare perspective, and with a focus on their communities. Both the certified webinar program and the new course we are presenting today are part of the initiative's training pathway. This curated pathway includes more than 20 courses in Spanish, English, and Portuguese, as well as technical webinars available asynchronously through the PAHO Virtual Campus for Public Health. I invite you to use this space as an opportunity for shared learning and reflection, allowing us to strengthen our capacities and move forward together to offer more integrated, higher quality health services centered on people and communities. Thank you very much.
Muchas gracias por acompañarnos hoy.
Vamos a compartir el video ahora de la
Thank you very much for joining us today. Now we're going to share a video. What?
Un segundillo, tengo un problema. Ahora sale, ahora ya sí, ahí vamos.
Muchas gracias por acompañarnos hoy en esta nueva
Thank you very much for joining us today in this new session of better care for NCDs. We're going to talk about how health promotion can strengthen comprehensible management of NCDs from an equity approach as health determinants. As we know, NCDs are a very important component in the disease load and health expenses in our regions, and they do not impact everybody equally. They mostly hurt those who are most vulnerable, and that's why primary health allows us to trace a pathway to transform structures and policies to face NCDs, and at the same time to strengthen well-being and health in lives. Although this is a dynamic process, we have to look at it from the viewpoint of a loss. We focus on disease and personal risk factors, but we are aware this is not enough when we don't look at communities or social determinants. Our reach is reduced, and as is the outcomes and effectiveness of our interventions. We have a less impact. Today, we have to expand that view and look at how we can strengthen healthcare that makes a difference in care for NCDs. Health promotion starts from a fundamental idea is health as a positive thing that is built on the conditions that created, and this includes the assets, the strengths in the communities and their capacity to protect health, and of course, the social conditions that determine if a people can reach their maximum potential inequity. In addition, a health promotion is by nature participatory and intersectoral. It requires working with different actors and communities and adapt interventions to the individual context of each territory. They act at a different levels from national policies to local policies, but at the local policies, they're particularly relevant because that's where, in those places where people live and work and relate to each other, that's where we actually build health. Oftentimes, interventions in health promotion are shortcoming and they focus on educating, communicating, and preventing advice about healthy well being. But these efforts, although important, are not sufficient. A fragmented approach that focuses only individuals will not have the impact that we research, and that's what is important to go beyond. We have to improve the people's living conditions and the context where they evolve, and at the same time, we must strengthen the collective actions and foster population scale initiatives that focus on structural components that and that's the only way we can have achieve structural changes. And these interventions must accompany people throughout their life cycle, because if we want to reduce the risk factors, we must act from the first stages of life and sustain our work across various generations in the framework of the better health care attention. We're going to focus on the work line that seeks to strengthen primary health care, to structure a health care approach looking at the social determinants to non-communicable diseases that involves teams and services. The idea is clear. When healthcare attention focus on primary health and their territories, the diseases and the outcomes in regards of NCDs improve in a significant manner. Why? Because the strength its community empowerment and strengthening the relationship with the territories that create sustainable impacts, prevents premature deaths, and reduces health and risk, and facilitate more real life opportunities. Recent studies also show that a community-based healthcare is more cost-effective and strengthen the health, in particular among peoples who live in more vulnerable conditions. It is important that in 2026 we will celebrate 20 years of the OTAN Charter that identifies the health prerequisites like health, education, food, income, and healthy and sustainable environments, social justice, and equity. Today, four decades later, these principles are still valid. We have moved forward as a region, but we still have a long way to go. And that's why we want to invite you from your own professions, institutions, and territories and spaces to strengthen your practices to incorporate health promotion in response to non-communicable decisions, because if we want to have a different outcomes, we need a different way of doing health and well-being. Thank you very much.
Bueno, muchas gracias a la doctora Jerry Eichmann, directora del Departamento.
Thank you, Dr. Jerry Eichmann, head of the social and environmental determinants of the health outcomes and reactions for their words, for their welcome words.
have with us today in this webinar from across Latin America and the Caribbean, and a special warm welcome to our colleagues from outside the region. I see our colleagues from Bhutan, welcome, and Italy, welcome. This webinar is certainly relevant to not only those dealing with NCDs and integration of NCDs in primary care in Latin America and the Caribbean, but beyond, because a lot of the topics that we'll be discussing today on health promotion and the importance of emphasizing health promotion as part of an integrated approach to NCDs and primary care are relevant to everyone to improve NCD care. Bueno, pasamos ahora a la primera ponencia sobre la promoción de la salud en el enfoque de las
Now we're going to move to the first presentation on public health care with a focus on non-communicable diseases. I'm going to invite Dr. Pilar from Abajo. I'm going to now share the presentation. Thank you very much, Silvana. This is Dr. Pilar Campos, the Regional Advisor of Health Promotion. I'm going to talk about the promotion of health from the for non-communicable diseases from a critical perspective. I'm going to start talking about what we're talking about when we mean by social health promotion. When we talk about health promotion, we think about lifestyles, collective health, and social participation, healthy municipalities, intersectoral initiatives, but we also think about some concepts like health promotion that are only focused on healthy persons, as well as prevention or that focus on prevention services. But it is also true that all other concepts that are shown in the slide have to do with the health promotion. The issue is when instead of working in a complementary or integrated manner, we work on a fragmented fashion, and we put more place more important in some to the detriment of others. In this sense, we have for a long time worked in looking at the tip of the iceberg that has to do with a more biomedical approach that focuses on health services. And this is a necessary approach, but it should be accompanied by other actions that focus on the living conditions of people, their environments, and how they influence that visible tip of the iceberg, and what we have been doing on health promotion, even more so at the bottom of the iceberg, to work on the social structural determinants that have to do with the distribution of power and resources and tax policies, gender, and class that must be incorporated in health promotion, that it should be extensively related to the social determinants of health if we want to have an impact for our work. In this sense, the definition that we use at the Pan American Health Organization that precisely comes from the Ottawa Charter that was mentioned by Dr. Herrickman in her introductory words that was launched 40 years ago, and that mentions that health promotion is a global social political process that aims at strengthening people's and communities' capacities. Those are the agents, but also the actions that are aimed at modifying social, environmental, and economic conditions, and that relates to the structural side. And this is even more so, even more so important if we want to create an impact. And with this, the positive on individual and collective health impact. This is work that has to be done with the participation in from an intersectoral view, involving several organizations and communities that work together to assure the health and well-being of all people. And in this sense, it's also important, as was mentioned earlier, that participation is essential if we want to promote health and this agency, this capacity of people to act independently and make conscious decisions and change and promote changes in the environment is important to be taken into consideration, but we also have to look deeper. We have to look at the structural components that the rules and norms in the social context that facilitate or constrain collective actions, and even deeper, the changes that are required to actually have a people in their agency capacities to make independent decisions. And with from this viewpoint of the iceberg example, and how this relates, for instance, to high blood pressure, cardiovascular diseases. At the tip of the iceberg, we have individual interventions that medicate persons or address the risk factors, the causes that create high blood pressures, like in inadequate diets or lack of physical activities, and to provide advice and education for health. But this is not enough if this does not include also more community approaches, community-based approaches that take into account how community conditions have an impact on health risks and conditions. And this takes into account safe environments without violence, and that allow us to move forward in these issues that we just mentioned. And finally, the more socially oriented public policies and public policies that allow to change the structures for people to actually be able to make healthier decisions. For instance, things that have to do with the commercial dimensions, and to strengthen affordable health, healthy foods, or protection against junk food and sugary drinks and tobacco consumption, and health policies that focus on access to health, education, employment policies, etc. All these interventions are complementary and necessary, but oftentimes we focus our work on those that are at the individual issues at the tip of the iceberg, when we are aware that if we approach more structural policies, will have a greater impact in reducing the disease load for non-communicable diseases. And we have also, as Dr. Reisman has mentioned, the importance of solid evidence that has been created, and how these are more social determinants, structural determinants, influence and health developments like heart diseases, education, food, the health system itself, and others that have an influence in creating factors like physical and mental stresses, lack of physical activities, health habits, and other elements that have to do with discrimination and community support systems, which are part of a causal systems that increases risk factors and results in cardiovascular diseases. And that's why the health and social determinants component is important. I'm not going to delve on these issues because Dr. Hugo Vasquez mentioned in a prior webinar where he explained all these relationships, and it is key to integrate a health promotion, the social determinants. And in this viewpoint also, we are aware that diseases are not distributed randomly, but are fundamentally distributed by the social and political structures where we live in. Our quality of living will be determined by our neighborhoods and the opportunities for education, work, rest, and entertainment, leisure, etc. So we are clear about the steep slope that is based on health, education, job, formal or informal conditions, living, environmental risks, health risks, and how all these things make it more difficult to have a good health, and that have a crucial influence on the NCDs, but also also mentioned in Dr. Vasquez's prior webinar that although we are aware that social conditions and low social economic conditions are among the stronger more death and morbidity and morbidity factors did not always include the social determinants as modifiable risk factors, and there are some interventions that can contribute to change these conditions, like through various public policies. Also, I wanted to share with you this transparency that was previously also shown to you that shows that how the availability of resources allows us to have access to certain conditions, and then how that contributes to disease and how socioeconomic conditions have an influence on the genetic aspects in the DNAs and telomeres is shortening and determines the early acquisition of a certain diseases that accelerates epigenetic aging, and this is partially modulated by unhealthy life habits. And there's been also significant progress in epigenetics that modulates the relationship between social and genetic aspects. After this introduction, I would like to share with you two key ideas that are worth mentioning, that was also mentioned by Dr. Eggman of Prevalence, and that we expect will be takeaways from this webinar. In the first place, not to place the responsibility on individuals and lifestyles without considering that these are social determinants, and also to promote more population-focused interventions in addition to individual approaches. We are aware that several studies have shown the impact of social services in people's health, and we see that the investment is particularly made on health behaviors and healthcare, but these should not be addressed in isolation, because they are conditioned by socioeconomic and physical environments that together make up 50% of disease developmental load. And from that standpoint, it is important that when we carry out our interventions, we are aware of all this, because there seems to be like very much importance attached to providing advice on healthy living habits. So we need to look at what is outside where the people's social context and conditions, because otherwise we are going to place all the weight in the load in our patients, and we make it responsible for their lifestyles, or we make it responsible for being overweight or not engaging in sufficient physical activities when they're everyday lives does not give them the conditions and the capacity to decide on a healthier lifestyle, but make it more difficult to take these initiatives. So it is important to always consider the social determinants in our consultations, and look at how the people live and how they work, what resources are available to them, what are their concerns and dreams. All this will give us a broader view, because when we talk about placing people and communities at center stage, we do not put sufficient weight on thinking that people have the ability to improve their health conditions. It is true that some of this can be done, but at the end of the day, it is the social conditions that will determine how the various risk factors and the diseases evolve. And also social determinants, including the health system as well, that is a health determinant push these people into this direction. The idea is to empower people, and that we start with the people's strengths to work together and look at the potential solutions that can be addressed, and mostly from a more community and population based approach. And here we're going to be talking about how we move from individual interventions. And I would like to mention Jeffrey Rose, a British epidemiologist, that showed that to reduce the low disease, it is not important to treat people with the high disease, but that means that we're talking about the tail of the curve, but that does not modify the curve itself. But when we work with a more population approach interventions, that changes the conditions that impact the entire population.
As we said, the burden of disease is not at the ends or the extremes, and this is also something that Rose said. They are in moderate risk. For instance, in this bullseye, in yellow is high risk, which are usually who come to the consultation and who are treated as priority. But here in red, we would have those with moderate risk, and we could say that we would have the healthy population in blue. So when we make individual interventions, as we said, the curve does not change, but the population impact is small. It has individual impact, but not for all individuals. When we have populational, we are able to address the whole curve and to reduce the overall risk, which also leads to more equity. And it's cost effective because policies benefit all and reduce inequalities. So if we aim at the yellow in the bullseye and we work with the moderate risk individuals, that will allow to work with a greater group of people, therefore to have more impact and to avoid many going into the yellow. And also when we work with a healthy population, this was also pointing out the importance of working throughout the first ages of life and throughout the course of life, and working with a healthy population in environments beyond the health domain. We can have the blue become thicker to decrease the red and to decrease yellow. So if we want to reduce the disease burden, we must shift the curve by promoting these populational issues. And in that sense, it will lead to not limiting health education to individual health, but to change the distribution of risk via those policies and environments and the participation of the community to be able to change social, economical, and environmental contexts that we also saw in the definition of the promotion of health. So I would finish with one last practical part, because often we say yes, but how in the day-to-day with primary care and daily practice we can develop it, because often social determinants are left outside the system. But no, in primary care, social determinants and the promotion of health and equity can also be included. And in that sense, the unit has advanced an operational framework to promote the equity and social determinants perspective in primary health that will be soon available, and which seeks to offer how in practice this can be integrated. So it is based on the territory. It identifies who are the key actors, the drivers of change, and some operational processes that can contribute to this. Key actors would be local governments, the community, and primary care first level attention teams who are in the territory, and it is important that there's an effort between the three. We will see next in the panel examples on how from the local government there can be work in addressing non-communicable diseases with the health promotion perspective. Also from the very community and from primary health teams, the key change drivers are intersectorial participation and social community participation. It is key to work with sectors beyond health who have the capacity to tackle those social determinants, which we say are key to change in order to change the curve and the disease burden, and the social and community participation, which is an essential element in promotion of health. And truly, if we want to contribute to greater equality and also to consider those vulnerable groups, We must empower it and set people at the center, but in this other way. 6 operational processes are identified: territorial health diagnoses centered on equity and the promotion of health and well-being, to perform participatory diagnosis, to know the context of the community and the work and the places where we're working is key. Also identifying and reducing barriers related to the demand to those people who are not having access or being able to adhere to the treatments proposed, because in order to work on joint solutions, also in mobilizing community assets, we say that it's key to start from the strengths of the community, and there are many resources for health and well-being that the very community acknowledges as assets, which are key to include in tackling non-communicable disease. And in that sense, social prescription is also an intervention that carries more relevance and meaning every time, and how it links to the many councils or work that is done from consult with the resources and assets existing in the community. It's also key to integrate social and health services and to work jointly with local governments, have, if they have skills involved in primary care or not, because it is essential to promote participation and to boost public policies that are relevant in order to advance along this line. As key conclusions, I would ask that when you hear healthy lifestyle, to think about conditions and environments, that when you hear about causes of non-communicable disease, to think about social determinants of health. Also, apart from individual measures, think about what populational measures can be put underway. When you hear about risk factors, also think that there are strengths and assets in the community that can contribute to combating those non-communicable diseases, to generate social cohesion, which is so important, community networks that will also positively affect decreasing the disease burden. Thinking about top-down interventions, also think about the importance of more structural interventions, and in that sense, advocacy that can be made to different institutions and at different levels of government. And when you see the tip of the iceberg, see that there's also a deeper foundation where it's important to continue working. There's no time for more here, but I invite you to go through this health promotion course that's available on the virtual campus, and which is also part of the schedule for better attention of non-communicable disease. Thank you very much, and I'll stop sharing here. Thank you so much, Dr. Pilar Campos, Regional Advisor for the Promotion of Health, PAHO. Excellent presentation. And to emphasize that the promotion of health must consider health determinants. It's not just to give counseling or to change lifestyles. And since we are almost 40 years after the Ottawa Charter for Health Promotion, I believe we do have much work to continue doing in order to really set those concepts, ideas, and the promotion of health into practice in all countries and all primary care centers. Thank you so much, Pilar. And to give us a bit of experience regarding how all those concepts are being implemented in the promotion of health and all measures to promote health and primary care for the prevention of non-communicable diseases, we have an excellent panel of representatives from some countries in the region, and I invite Dr. Oriel Solar, head of the Promotion of Health and Social Determinants of Health Unit, to lead this panel. Thank you so much, Silvana, and good morning, everyone. After this excellent first presentation from Pilar, which gives us a framework, let's look at concrete experiences and reflections from countries, both international and local and community levels. And for this, we have 3 excellent speakers who will exchange with us. First, we will have a presentation from Dr. Maria Terol, who's a Deputy Director of the Promotion and Equality in Health from the Ministry of Health, Spain. She's a physician and a specialist in family and community medicine and preventive medicine and public health with experience in health promotion, equality, healthy environments, community health, and maternal infant, mother-infant health. Then we will have architect Herman Ricardo Camacho Herrera, who's mayor of the Pulp district in Boyacá, Colombia. He's chair of the executive committee for the movement of municipalities, cities, and healthy communities in the Americas. Currently, he runs a master's in sustainability. Throughout his professional life, he has served in important positions in the public sector and has outstanded by his leadership in important developments in the working domain and from architecture and urbanism and the relations of territories, a key aspect in the construction of health and the role of local governments. And third, we will have Dr. Maria Nazareth Faria, who has coordinated for many years the community health program from the Ministry of the Community of the Province of Formosa, Argentina. Currently continues working and supporting some projects. She's a physician, a specialist in family and community medicine, trained in Ayurveda and homeopathics, and has a long-standing experience in working with the community. How we understand the role of community health in this construction and this tackling of non-communicable disease and health as a whole. So we leave you first with Maria Terol to get you motivated about these important and motivating speakers that we'll have today. Come in, Maria.
Buenos días, muchísimas gracias
Good
por
morning, and thank you so much
invitarnos
for
a
inviting
compartir
us
la
to share
experiencia de España en promoción de la
the
salud
experience in
en el
Spain in
marco de las
health
enfermedades no
promotion
transmisibles. Y lo
with
primero
regards to
decir que
non-communicable
lo primero
diseases.
que
And the
será es fruto
first thing
de
to say is from
trabajo
everything I'll present,
colectivo de
this is
mucha
a collective
gente, sobre
effort
todo
from
del
many
equipo
people,
aquí de la subdirección de
both from
promoción
the
de prevención
team
y
and
vigilancia en
the
salud,
under direction
como
of the
también
promotion of
mucho trabajo de
equality and
coordinación
health,
con las
as well
regiones,
as
con las
co-creation
comunidades
efforts with the
autónomas,
regions and
entidades
autonomous
locales,
communities, local
asociaciones,
entities,
etcétera.
associations, and so on.
Y bueno, nosotros desde España también trabajamos en este
And in Spain, we
enfoque
are
de
also working on
determinantes sociales
this
de la salud
social determinants of health
y
perspective,
pues con este enfoque que hay unas
with
causas
this
cercanas para
perspective that
estas
there
enfermedades no
are
transmisibles, un
Perdona,
contexto
near,
perdona,
cercano.
María, perdón,
Sí,
María, no se ve la pantalla en versión completa,
apologies,
se
we cannot
ve.
see
ahí
you in
está.
full screen.
Disculpad. ¿Así?
Apologies.
Perfecto, ahora sí.
Bueno, como venía diciendo,
Great,
el
there we go.
contexto
As I was
cercano, ¿no?
saying, the nearby context
En estos
affects
comportamientos de las personas, pero
the
que estas causas
people's
están influidas
behaviors,
por
but
otras
these causes
causas
are
que son
affected by other
estos enfoques
causes,
de estos,
and we
estos
have
determinantes
these
sociales de la salud.
social
Y
determinants of
además,
health,
bueno, trabajamos
and
también con este enfoque
also we work
saludológico que
with
ya se ha
this
mencionado, que no solamente vemos desde la
healthogenic
perspectiva del riesgo, de los efectos negativos de
perspective.
los
Well, we not
determinantes,
only
sino que
look at
vemos
risks and the
personas,
negative
familias,
aspects of determinants, but in
enfermedades,
people and families and communities,
factores y fortalezas que nos
there are
hacen
factors and
mejorar la
strengths that
salud,
make
¿no?
us
Y
improve
desde
health.
aquí
And from
articulamos
here,
cómo
we
trabajamos la
articulate how we
promoción
work
de la
in
salud. En
promoting
primer
health.
lugar, estas
First,
causas cercanas lo
these
hacemos en
nearby
un
causes, we
abordaje
do so
integral de
with
todos estos
uh,
estilos de vida saludables,
comprehensive
con un
tackling
abordaje
of all of
biopsicosocial
these
que no solo
social
está enfocado
determinants,
en
which is
planificación, sino
biopsychosocial,
también en ese
not only
vínculo
through
desde la atención primaria con los
literalization, but
derechos
from
de la
that link from
comunidad y
primary
cuando hacemos educación para la
health
salud con
with
un enfoque de
community resources,
determinantes
and when
sociales.
working with health with a
En este
focus on
contexto
social determinants.
intermedio
In this
comunitario
intermediate
estamos haciendo
community
un impulso
context,
muy
we
importante
are
a la salud comunitaria
working
y ya
importantly
tenemos
in
una larga
community
tradición de
health, and
trabajar
we
en los
now have a
entornos
long-standing
saludables,
tradition in
tanto en las
working
ciudades
with healthy environments,
saludables,
both in
escuelas promotoras de
healthy
salud y
cities,
universidades promotoras de salud.
health
Y
promoting
trabajamos también a nivel de
schools
las
and
políticas,
universities.
esta
And we
acción
also work at the
intersectorial
level
en
of
salud,
policies, this
intentando promover la
intersectorial
salud
action in
integral en
health,
todas las
attempting to
políticas,
promote health
intentando también
inequality throughout the
impulsar la
policies and
evaluación
trying
de
also to
impacto en
foster
salud y, sobre todo
impact
últimamente,
assessment in
intentando
health, and
abordar
especially lately trying
estos
to tackle
determinantes comerciales de
in
la
these
salud que
commercial
impacto
determinants of
tienen y que,
health
bueno,
that
la
also have
verdad
an
es que
impact, and
trabajarlos a nivel
truly
internacional es muy importante
working
también.
internationally is
Y esto
important
que
as well.
parece un
And
marco
this, which
así muy
seems
abstracto,
a very
vamos a
abstract
aterrizarlo un
framework,
poquito
we're going to
pensando en
ground it
Marisa, ¿no?
thinking
Marisa, que tiene
about
50 años,
Maritza,
entra a consulta
who is 50
y
years old, comes
pues
into a
parece que
consult,
tiene que mejorar
and
un
it
poco
seems
sus
she needs to
estilos de
improve a
vida.
bit her
Pero si
lifestyle.
nos quedamos solo en
But
Marisa y no vemos cuáles son
if
sus condiciones de
we
trabajo,
look at her
si
working
debe cuidar
conditions,
también a la familia,
that
si
she
tiene
also
una
has to care for a
plusvalía, si su
family, if
barrio
she
se
has
puede
family
moldar
support, and if in her
fácilmente,
neighborhood you can move
pues
around easily,
quizás podemos culpamos a
perhaps we
Marisa en vez de
can blame
conseguir que alguien
Maritza
cambie sus
and not
estilos de
get
vida,
her
¿no?
really
Y esto
changing
es
her
mi
lifestyle.
enfoque de intentar
And
hacer
this
que
is
las
the
opciones
perspective of trying to
más
have
saludables
the
sean
healthier
las
options
más fáciles.
become the easier ones.
Lo primero, desde la
The
parte de
first thing
atención
from
primaria,
the primary
en
care
el año
part,
2019 hemos
in
hecho un trabajo muy
2019,
importante en
we
el marco
did an
estratégico de
important
atención
effort
primaria
in the
comunitaria
strategic
para
framework of
intentar
primary community
hacer una mejora en una
attention to try to
reeducación
improve
de
and
primaria.
readdress
Y hay
primary
una
care.
línea específica
There is
que
a
es para
specific
reforzar la
line which is
orientación
to
comunitaria, la
reinforce
promoción de la salud
community
y la
orientation
prevención
and
en
the promotion
atención
of health and the
primaria y
prevention
salud.
and primary health
Aparte de
attention.
fomentar todo lo que tiene que ver
Also,
con
to foster
coordinación,
everything pertaining to
lo hemos organizado
coordination,
en
we
tres
have
niveles, o
organized it into
tres
three
niveles de la
levels. The three
orientación
levels
comunitaria, que es el nivel
in
1 a
community
nivel
orientation,
individual y
level one is
familiar,
the individual and
el
family
nivel 2
level.
más
Level
grupal,
two
educación para
is
los
more
hijos,
group
o el nivel 3 más
in
de
education
salud
for health, and level
comunitaria
three
o un
more in
nivel
community
más
health
colectivo.
or a more
Y
collective
en esta
level.
parte de
In this
coordinación
part for coordination,
vamos desde lo más micro
we
a lo
go
más
from the
macro.
micro to
A
the
nivel
macro.
micro se está
At the
impulsando
micro level,
que se organicen
we are
consejos de
fostering to
salud o
organize
comisiones de
health
salud comunitaria a
councils
nivel de
or
territorio con la
community
participación de todos los agentes
boards with the
que trabajan
participation
en
of
la
all
comunidad
agents working
y
in the
con la
community
participación de la
and the
ciudadanía.
participation
Y
of
esto luego se va a
citizenship. And
reflejar a nivel de
this
los
later has
niveles
a
autónomos y a
reflection at the
nivel
level of
estatal,
autonomous
donde desde
communities and
salud
at the state
comunitaria
level with community
intentamos
health
impulsar
groups that we
esto
try to
en el
foster
marco
this
del desarrollo de
in the
estrategias
framework
de
of
salud
developing
comunitaria que
strategies of
ya
community
13
health,
de las 17 comunidades
which
autónomas
grows
cuentan
and
con
the
una
17
estrategia de
autonomous
salud
communities now
comunitaria.
have a community health
Y
strategy.
este nivel individual
And this
o
individual
nivel
level
primero, ¿no?, de
or
orientación
first level
comunitaria
of community
consistiría en
orientation
hacer un
consists
abordaje
in
biopsicosocial, desde la consulta de atención primaria, buscando una
biopsychosocially
revisión
engaging
clínica
from
o
primary health, both in
encomendando los
clinical
recursos de la comunidad como
interview
podemos
as
a
well
atender a
as
las
gearing
personas de
community
esta
resources
manera
on how we
integral.
can tend to people in
Estamos
this
haciendo
holistic manner.
también un
We are
esfuerzo importante
also
por
running an
incluir
important effort to
en la
include
historia de salud
in the
digital
medical history,
los
digital medical
condicionantes
history,
sociales y de contexto
social
familiar
conditions and family
que son de
context
esa persona que nos van a ayudar
of that
a hacer un
individual, which
abordaje
will help
adaptado
us
e
to
integral. Una vez que hacemos esa entrevista teniendo en
perform
cuenta todos esos
adaptive
condicionantes
engagement.
sociales y ese contexto
Now,
familiar,
considering all of those social
podemos
determinants in the family
orientar
context, we
hacia los
can
recursos de la
guide
comunidad
toward
o
community
incentivos para la
resources
salud que le van
or
a
assets for
facilitar
health that will
generar esos estilos de
facilitate
vida. Para ello
generating
contamos
those
con un
lifestyles.
mapa
For that,
que
we
se
have
llama
a map
Localiza Salud,
which
donde
is
podemos
called
ir publicando estos
Locate
recursos.
Health, where we can begin publishing
En
these
este
resources.
nivel más grupal
At this
o
more group level or
colectivo, ¿no?, estamos
collective,
haciendo un
we
impulso
are
a lo que llamamos salud
doing a
comunitaria,
foster into
estimulación
what we call
comunitaria en
community
el
health, which is
territorio.
like the
Es
community
decir,
action in the
cómo dinamizar
territory,
la
how
intersectorialidad y
to
la
dynamize the
participación en el nivel
intersectoriality and
territorial
participation at the
pequeño.
territorial level
Para
that
ello
is
hemos
small.
publicado esta guía
For
que
this,
se
we
llama
have published
Acción
this guide, which
Comunitaria
is
para
called
Ganar
Community
Salud
Guide
o cómo
to Gain
mejorar,
Health, or how to improve,
cómo trabajar en común
how
para
to work
mejorar las
in
condiciones de
common
vida.
to
Y
improve
bueno,
life
también os
conditions.
digo que está publicada
I
también
can
en
also tell
inglés.
you that it is
Y
published
en esta
also in
guía hemos
English, and
consensuado
this
cómo
guide we have
trabajar en los
consensuated
territorios,
how
cómo
to
hacer
work in the
esos
territories
ciclos
and
de
how to
acción
make those
comunitaria donde trabajamos en
community
común con los distintos
life
agentes de
cycles
las
and how to work with the
instituciones,
different
los
agents from
profesionales
institutions,
y
the
la ciudadanía,
professionals, and the
y vamos
citizenship.
explorando cómo está
And we
la
begin
comunidad,
exploring
cuáles son
how the
las
community is
necesidades
doing and what
y
are the
fortalezas de
needs
esa
and
comunidad
strengths of
y
that
cómo pueden
community,
trabajar juntos y juntas para
working together
planificar e
to plan
implementar
and
esas
implement
intervenciones que se
those
prioricen y
actions that are
evaluar y volver a
prioritized
hacer
and to
esas
assess and
dinámicas en el
to
ciclo de
do
acción
those
que van
dynamics again in the
generando
life
esas
in
redes
the action
comunitarias y
life
esa
cycle that
cohesión
generate these
social.
community networks and that social
Por otro
cohesion.
lado, contamos con la
On the other
estrategia de
end, we
promoción de la
have
salud y
the strategy
prevención,
for the
que
promotion
se
of health and
centra en
prevention,
los
which is
factores de
focused
riesgo
on
más
the
asociados
risk
a las
factors that are
enfermedades
most
no
associated to
transmisibles. Pero
non-communicable
desde esta
diseases.
estrategia
But from this
trabajamos
strategy, we work
en un enfoque de entornos, ¿no?,
in
sobre todo
an
priorizando
environmental
el
perspective,
entorno de
especially
atención
prioritizing
primaria, el
the
entorno
primary
local
health
y el entorno
environment, the local
educativo.
environment, and the educational
Y en
environment.
relación con el
And with
entorno
regards to
local,
the local
tenemos un
environment,
convenio
we
para
have an
trabajar
agreement
con la
to
Federación
work
Española de
with
Municipios y Provincias para impulsar la
the
promoción de la
Spanish Federation of Municipalities and Provinces to work locally, and we have two initiatives. On one end, the Spanish Network of Healthy Cities, which has 552 local entities adhered, and with the local implementation of this strategy for promotion of health and prevention, which especially prioritizes two actions: to simplify one intersectorial work group and to do this map of resources and assets for health that we will later link to primary attention. If you remember from primary care, this recommendation is made of assets in the community based on the features of the person, and those assets and resources are already mapped because from the local entities and autonomous communities, those resources are identified and that map is enriched. In turn, we work on different themes or topics to facilitate those actions in those healthy environments to be the options that are more simple to take. And we focus specifically on aspects which we believe have much impact on non-communicable disease and the promotion of health, such as active mobility, facilitating healthy routes. We have published this guide of Paco and Paca to facilitate going to school, which is called Bike to School and Bike Back Home, and many actions that we work intersectorially to achieve healthy urbanism. Concretely, we have made a recent guide on tactical urbanism, which are very simple and cheap actions that make possible changes in the dynamics of distribution in urbanism. This is our map, Localiza Salud. As you see, we have many resources and activities in the communities, and you can search by factor or also by population group. In that community, other key elements that we have when we speak about environments are schools, education centers. And education is one of the social determinants of health that most affects health. And from Spain, we are trying to foster the health promoting schools model. We have published this guide for health promoting schools, and we were working as a network to facilitate there being a network of health promoting schools to facilitate an exchange of experiences. We facilitate online training, we host encounters, and we're also working to create a seal of health promoting schools for those education centers that already have advanced to acknowledge that effort. From primary care, the link to education centers in the area where professionals in health are at is very important, and always it can be supported. The dynamics in education centers for promoting health. And then we would have the last section, which is how we work on policies. In Spain, we try to work intersectorially, bilaterally with many sectors. Education, we already named it, but others such as social rights, consumption, ecological transition. There are many, but we tried to set here this example with the National Strategic Plan for reducing child obesity as an example of intersectoriality. In Spain, child obesity is related to poverty, a very important social determinant. So we have joined 18 ministries to each develop different actions to change that environment. I leave you with the repository that we have of activities and publications in promotion and education of health. If it is of your interest, and to summarize, when we are from primary care, how to tackle from the perspective of the promotion of health, non-communicable diseases, then we have this key of biopsychosocial work. We are at the consult to care for the context and how to do this community guidance and not to facilitate that social cohesion and community networks that make communities more healthy, more equal, and more resilient. How from the location we are at, we can favor those healthy environments, and how we are in education centers and healthy cities and working in that intersectorial action, and all of this with an cross-cutting equity perspective. Thank you so much for your attention.
Muchas gracias, Mariano.
Thank you so much, Maria. A major motivation for each of us, this vision from a national scope that has been worked for long, which sheds some light and very useful, very current also for the region. So now we're going to the local domain or level. We leave you with Germán Camacho, Chair for the Movement of Cities, Communities, Healthy, and come in, Germán, please. Thank you so much, Dr. Ariel. Very special regards to everyone. Thank you for the invitation to share our experience. As said in the introduction, my name is Hernan Camacho. I'm mayor of the Paipa district in Colombia, municipality of 40,000 inhabitants with a lake, as you see in the picture. We make a living off tourism, but it is also a very rural municipality. We have 38 sidewalks, which also has us to place major attention not only in the urban but rural. With that introduction, we will quickly share our experience in holistically tackling health based on primary health. To tell you that the major pro and on a personal note that I consider among the tips that have made PAIPA to take a step forward on this matter is precisely the comprehensive or the integral information system for public health that has been acknowledged by WHO in Geneva. This IT system is one of the best experiences worldwide for multisectorial action for preventing and controlling non-communicable diseases. What's most interesting is that from these 17 experiences or projects that were presented, the only one going from one municipality was our own. The other 16 were basically going from ministries of health in different countries, which is important because this is a space where our territories and municipalities and communities, as I said, this is a city of 40,000 inhabitants, and how we can produce health strategies. And another tip is health governance. And this is building on what's already built and giving it continuity. In most countries, surely mayors are there for 4 years or so, and when an administration ends, another one arrives with other thought, other interests, and resources are cut off. And in our country, we have been very aware about this, and there has been a political willingness to continue working on health governance. And so that we have these three elements, which are municipal agreements presented to the council, dated 2021, where initially a process was generated in order to adopt PAIPA as a healthy city. Later, the IT system is adopted as one of the strategies and policies to be able to work on health. And the recent one for 2023 is where the regional criteria of the movement are adopted. As said, we are now at the chair of the executive committee, which is very important because it gives it continuity and also more trust from the very community and understanding that every 4 years the rules of the game will not change, that we have a clear north, and that's what we're working under. And we are, when speaking about characterization, monitoring is identifying gaps and needs, intersectorial management, that has been mentioned in previous talks, not having health as a secretary or dependency remote from everything else, and where we often think about addressing health but not prevention. All of this would be valid by working with the community, as has also been said by the previous speakers. But before passing the slide, I would like to emphasize information. We consider that the quality of information and the truthfulness and currentness of information is very important. We who have this duty in leading territories, we generate policies and actions based on planning. And how do we plan with information? But if we plan with information that is wrongful or outdated, surely actions that we generate from that planning will be wrong. One might think colloquially or quickly to say, I know that I'm planning with wrong information, then I will have 100% chance that what I'm doing is wrong. So sometimes it's best not to have information and do it spontaneously, or at least they have 50% the chance to do it properly. This is an exercise that is tiresome, but we can have all policies, strategies, human resources, technology, and willingness and in the intent. But if information is not truthful or not current, surely we will make more mistakes, or at least not as assertive in action.
Porque este sistema de información que es el gran plus, pues es el que nos da esa garantía que tengamos información actual. En algunos países, aquí también trabajamos a nivel de Colombia con una información que se llama el CISBEN, que es el sistema de selección de beneficiarios. Pero esto es una fotografía en el tiempo, es decir, a mí...
But this is a snapshot in time. 4 years ago, a survey was made in my personal or family situation apart from community. 4 years ago, I could have my children outside of school. 4 years ago, perhaps I had a job, but I no longer have one. Just to name some of the actions, perhaps I lived at a rented house with some public services, and suddenly I no longer have it. So we propose actions regarding that snapshot from 4 years ago. That's why primary health and the actions being led by the Ministry of Health in Colombia in strengthening primary care. Today we have this information that you see as geo-referenced. But we also have overcrowding, water treatment, and many determinants and risks identified that if they are not geographically mapped in what population, in reality, then surely the actions generated to prevent those risks are very important here.
A través de ese sistema de información, y es esas dos líneas, es el enfoque de riesgo, en el cual justamente ustedes se dan cuenta que la torta estadística.
And along this risk approach, you can see that the Apache shows a 7% participation, which is very efficient. That was mentioned in the prior presentations. In today's exercise, we have seen the social determinants and these initiatives, and that sometimes we look for those who are responsible in areas where they are not. So we have to act on the environment, reduce these risks, and identify social determinants. These photographs are very recent from the APS, where we have worked with significant teams in technology. And then it's not just a matter where the people tell us what happens in the hospital health service, but rather to go to the communities and look at their living conditions. And with that data, we can have reached 80% of coverage, making sure that we have a real data. And these visits also include some sort of alerts and warnings and prevention. But look at the importance of this chain. It is not just a matter of having expert teams with the specialists, but these teams are accompanied by community leaders that know the community, and also nurses and other people that have the knowledge to collect the data. But this is important, but also using the technology that is available and important to tally and interpret the data. And on that basis, we can work on a intersectoral basis. This information used at our municipality, and having adopted the regional cities movement, we connect our health plans, and when we determine what we will be discussing in the city councilors meeting next week, we will decide what we will be doing from an intersectoral basis. When talking about health, we talk about the health services that involves the community in the community work for basic services like water and sanitation, sewerage, and water quality. All that is a health and data that we collect, and we try to be as assertive as possible. We cannot create generally a line of action when there is some also some peculiarities that have to be taken into account. And as was mentioned in the intervention about Spain, we have a great responsibility to intervene in public spaces that should be a safe and that creates a healthier environment. And this also involves the communities. I'm an architect and I have always been very pleased by community participation. These are photographs of a sports field in a school that was designed based on the children contributions. The winning drawing was made by a girl with disabilities that in her drawing included all the minimum characteristics of such a sports field that would take into account her the particular conditions of the persons with disabilities. Also, we have the family orchards, and these are actions that are created based on the information system that involve a greater health component than we typically think of. We, of course, pay attention to things like hospitals and equipment, which is undoubtedly also very valuable. But the data we gather, and this is relevant not just for here, but also worldwide, that we have become aware of in various events that has resulted in debates about issues that have not been paid a sufficient care, and that is health givers that we in mental health. And these are two important things that have been taken into account in EPS. When we listen to the people, we realize that these are very complex issues, and that's why it is so important to take into account the community's contribution. As a president of the cities movement in our meeting in Santa Cruz in Bolivia, we made it clear that the ministries of health they should be called ministries of health and culture because, for instance, in our municipalities, the hot springs are not only a tourist attraction but also a component to improve our community's health. That's thermalism that we have been promoted in our community. And when it comes to emergencies and disasters that sometimes we do not take sufficiently into consideration, we have these epidemiological watch committees and health, natural health, natural risk oversight committees, and the healthy municipalities should be talking about sustainability as well because it has a very strong relationship with overall human and even animal health. We work together, for instance, as you see in this photograph, with recyclers. And thank you very much for giving me the opportunity of sharing with you the approach that we have for the healthy communities in the Americas movement. Thank you very much, Herman. Time is always short, but it'd be great if we could have some exchange about the experience sharing, I'm going to turn over to Maria Nazaret Soria, who is our last speaker. We have only a limited time, but over to Maria to share with us the experience in Formosa in Argentina. Thank you very much. Thanks for the information, invitation to this webinar that has addressed such an important issue. And thanks to the other members of the panel for the interesting reference that I have shared with you. I'm going to share with you very briefly our experience in the community health in the Formosa province in Argentina, in where I have been working for the last 13 years already. For you to better know where I come from, province, the Formosa province is in northern Argentina on the border with Argentina. It is the second youngest province in Argentina. Its peculiarity is that it's a multi-ethnic and pluricultural province where there are many ethnic groups in this region as well as rural communities and communities that are descended of the neighboring Paraguay country because of historical migration as a result of several wars in this region. So it is a very diverse community, and the community health program was born in February 2002 in the Ministry of Human Development of the Formosa province. That's the health ministry that's called Human Development Ministry here. And until 2009, the community ministry was created in the Ministry of was incorporated in the Community Development Ministry. In 2001, there was a very big economic and political crisis, and the decision was made to set up this program to work with communities based on the community knowledge and on the provincial constitution that holds that the province is responsible for primary health care as a critical element of the health system. And starting with this political initiative, we set up the program to coordinate the program based on the ideas that communities involves everybody, the environment's health, and community-based knowledge with a view of creating healthy environments in all communities to value the local communities' knowledge and to enhance the self-esteem of communities and their knowledge and include other therapists to the public health system. Over during this time, another of the objectives was to promote the self-organization of communities to extend life. And all strategies and initiatives of the community health program are carried out with the overall objective of promoting the community's relations health. That's the relationship between people among themselves, their families, their neighbors, and the community where they're included, and also the relationships of people with other lifestyles like animals, plants, water, health, the entire surrounding environment. So there is a very strong impact on the promotion and the promotion from the viewpoint of environmental care, stewardship, and to value the knowledge of the communities and how to take care of a life. Some of the activities that I'm going to be sharing and some photographs that to have taken place over these 23 years, and particularly focus on the people that are involved. The interdisciplinary team of a community health program, the team there is a mobile team that includes different participants depending on the political conditions at a given time, but is basically made up but people, including doctors and nurses, psychologists, nutritionists, social workers, uh, teachers, rural teachers. Well, it is definitely interdisciplinary. It also involves the educational community of primary and private and public primary and high school teachers in some public universities. The human development team also works in coordination with the human development ministry in some activities involving community and neighbors in the capital city and the interior and rural communities, as well as indigenous communities. The main actions carried out by the program include uh, community meetings, that's spaces that are open to share self-management practices for comprehensive health from a perspective of people's health so that everybody knows and learns from each other. These community meetings where different knowledge is shared, like, for instance, medicinal plants, agroecological gardens, other healthcare initiatives like digital puncture and relaxation and techniques and therapeutic gymnastics for the communities. But there are also another lines of actions like health caretakers in the schools, in the capital and interior schools, and a nucleus program is the Our School Garden, where activities are carried out with all students to build these gardens in the schools, the school gardens, and using these, and also working with the teachers to look at the difference, to teach the various courses that are taught at the various school levels like geography, mathematics, and natural science, all these courses that are taught to kids, school kids. In this project, we build these community-based school gardens, but we also have healthier food and kitchens to introduce these topics in health disease preventions from a very early life stages. Another line of actions are the healthy relations promotion by adolescents in various localities and also on demand. The province runs a addiction prevention and addiction and treatment center, and that works with the users of these institutions. Another important action line is the health community multipliers that's free of charge and focuses on community leaders that want to multiply this knowledge, that want to carry out these, organize these community meetings. So these actions are all on demand from various localities that require the program to organize certain meetings addressing particular topics they want to address and to program the related activities, also take into account the community interests and the territory conditions and interests. So basically, these are some photographs of our community meetings where we focus on community participation and listening to all voices, and also take into account that health professionals are community members. Health professionals don't go to communities to tell them what to do because they know and the community doesn't. Everybody is a community, and we all know. So all the knowledge is recorded and is addressed in these meetings, and recorded in various documents and posters, and shown in various posters. And at the end of the year, the community is given back the registration of knowledge that is going to be taken into account for future activities. So this is work to strengthen the community's self-esteem. that is aimed at building knowledge collectively and to strengthen relationships through dialogue. And these photographs show healthy food meetings where the program proposes a given food recipe, but during the meeting, other ideas are proposed that are used in future meetings and reunions that always take into account local ingredients and using non conventional plants, erroneously called herbs, bad herbs, and weed that have many nutritional values, and we look how to and where to collect them and store them safely. And we also share many traditional recipes, local recipes, and everybody cooks and everybody eats and shares. These are basic, simple, economical recipes that can be used on a daily basis by families and households, and that are also tasty and savory. So this involves grown-ups, but also children in these food meetings. And it's like preventing non-communicable diseases based on community knowledge. We also have medicinal plants reunions supported by the Human Development Ministry that has a number of technical standards for preparing pharmaceuticals like healthier soaps and preparations to fight pediculosis, and based on the contributions from the communities. This is our school orchard, school gardens initiative that involves several schools in the capital and the interior, and teach kids the origin and different types of foods. And these they are also multipliers in their families because the knowledge they learn in schools is taken back to their families, and they can also grow some of these vegetables in their plants. And they also use natural, simple, healthy recipes in the schools, either in the classroom or the school kitchens, because there are several options in the program. And then we have the community multipliers. This includes covers six topics. In the first place, to become a multipliers. This is more like the philosophical concept underlying the community health of a families, pregnant mothers and children, and ecosystem of plants and care and healthy education and the agroecological orchards, learning our body and comprehensive sexual education and taking care of our planet. The methodology of all these meetings and activities is based on people's education for comprehensive health with the community based on the concept that we all learn and we can all know together. It is a participatory based on our own customs and traditions and history of our communities, and a practical living approach. The meetings always have a practical activities at the central axis. So this is basically the experience of our program that we have carried out for several decades, that we are very proud of, and we will continue to incentivize these meetings and practices. Thank you very much for your time and attention. Thank you very much, Maria, for your sharing this outstanding activity that involves the local communities, that involves the knowledge, various knowledge. And thank you, Herman. Thank you, Maria. We have a very little time. You can turn it over to Silvana, who's going to share about the new program we're launching. We have registered all your questions and comments. I'm going to turn it over to Silvana, and thank you very much to you and the speakers. Thank you very much, Dr. Oriel Solar and Dr. Pilar Campos of the Health Promotion Department and all the members of the panel about the excellent and highly motivating experiences in Spain, Papa Formosa, and to promote in practice how this relationship between the health promotion and non-communicable diseases prevention can be linked in primary health care. I want to remind you that this webinar is part of a series of certifiable webinars, and the chat shows the link for you to get your certification for participation in this webinar, but you also have to complete the 5 webinar series to get your certificate. So we encourage you to continue following the 5 seminars and get your certification. We have now reached in our agenda the launching of the new course in the better healthcare for non-communicable diseases in primary healthcare webinar series. This new course is focused on community health workers to improve our health care, and many of the concepts that we have shared together about self-promotion and community participation and the health determinants are included in this course's syllabus. But before we launch the program, the course, I would like to go over very quickly. Let me share my screen now. The initiatives for better health care, because we want to share knowledge about this large initiative that we're implementing at APAHO to increase the percentage of people that are diagnosed, treated, and controlled in regards of NCDs, because we're aware that most people that live with high blood pressures, diabetes, or have some cancer signs and symptoms are not diagnosed in an early manner or have access to a proper treatment to control their condition. So we have developed this initiative to incorporate in the first level of care the care for NCDs in a comprehensive manner. We start with this diagram that shows the basic concepts that we promote as better health care for NCDs, starting with health promotion, advice, and education for healthy living, like health promotion and advice, for instance, to stop smoking or to promote a physical activity or to discuss the health determinants and lifestyles. We also include cardiovascular diseases that we are aware of the main causes of early death among entities in all Latin American and Caribbean countries. We have heart interventions for high blood pressure interventions, as well as obesity, diabetes, early uterus and breast cancer detection and primary health care, and also to improve asthma and EPOC, CPOD, to strengthen health of chronic respiratory diseases. We also are implementing a number of strategies in 6 areas. In the first place, to start with a diagnosis of primary health care and in a health territories or networks to identify the gaps and the needs to improve the diagnosis and treatments with in SCDs of patients, and based on these needs and gaps to prepare operative plans to expand comprehensive health of NCDs in a primary health care. And in the second strategic area, what we are discussing today is the community approach, community participation in NCDs, healthcare from a equity approach. And the third strategic area addresses the norms to have clinical guides and algorithms that are simple and essential that can be followed for the diagnosis, treatment, and control of persons who have NCDs with approach of improving the quality of care. And the fourth strategic area is the building of a professional teams for primary health care. And this is where we have a focus in these certifiable webinars series and the entire formative itinerary of this initiative to improve health professionals that are working in healthcare, primary healthcare, and finally the introduction of technology and for health, primary healthcare, and adopting better protocols to take care of persons, patients with NCDs. This training itinerary altogether includes affirmative actions that includes virtual seminars and workshops like this one that practice in communities and developing competency profiles for the various professionals like doctors in the primary healthcare PHCs and pharmacists and health workers. And we have organized these formative internerds on the competency basis for clinical competencies and skills for diagnosis and treatment for NCD patients and also public health programs training from a comprehensive approach, not just a health approach, but also monitoring, administration, logistics, and finally the competencies, data competencies for monitoring and following up key indicators to measure diagnosis, treatment, and control indicators. In this affirmative itinerary, we have over 40 courses that are grouped in this clinical competences, management competencies, and data competencies areas that are focused on health teams involved in primary healthcare, but also the decision makers involving health programs. So we invite you to visit the affirmative initiative and enroll for some courses, whether for health promotion or health determinants and diabetes patients or cervix cancer diagnosis. We have a broad supply of courses. The QR code is shown here to access this affirmative courses. And I would like also to underscore that it's extremely important to realize that these courses are aimed at improving competencies care, health care of patients and patients of NCDs and to promote early deaths resulting from NCDs. This is training that focuses on persons that are primary health care professionals and clinicians, but also the decision makers. And this is connected with the key tools because we have many available resources at PAHO for continued training and human resources building. So this formative itinerary aims also at expanding the use of all these tools. And I would like to conclude by strengthening that these are certifiable courses by the PAHO virtual campus. They're available in English and Spanish and some of them also in Portuguese. And we invite you to use these courses in our virtual campus and to enroll in the formative itinerary. Now we're going to listen to Dr. Seti Hospitals, who is working on the better health care of for patients with NCDs and has been involved in the design of these courses. I'm going to stop sharing my screen now.
Stop sharing here. Not sure why it stopped. It's not stop sharing. No, it's not stop sharing. I'm not sure.
Gracias, Silvana. A mí me da, buenas tardes, buenos
Buenas
días.
tardes, Cintia. No sé si tú
Me,
sabes por qué
me
no.
da la opción de intentar compartir y cerrar tu
Ayuda,
presentación.
ya.
Ahí está, igual. Ok.
Ya.
Muy bien.
Ok, ahí está.
Ahí se ve. Vamos a ponerla completa. Bueno,
Sí.
buenos días. Gracias, Silvana. Muchas
Good morning and
gracias.
thank you, Silvana. Thank you so much. We are now
Hacerlo corto y va a quedar grabado como todos los webinarios de
out
este
of time,
ciclo,
so
así que también van a poder escucharlo si
well,
se
this
van y
will
lo pueden
be
bajar después.
recorded. If you have to
Bueno,
leave, you can
esto
hear this later.
agradezco y estoy muy feliz
I
de
would
poder
like to
compartir
think I'm very
un
happy
nuevo
to be
recurso
able to share a
tecnológico
new
de la iniciativa
inter-program
Mejor
resource from
Atención.
the initiative
Automático quiere
Better
decir que
Attention.
trabajamos en equipo
Inter-program
y
means we working as
trabajamos
a
juntos
team
y
that we
agradezco,
have
aprovecho
worked
para
together,
agradecer
and
a
I
todo el
take this
equipo del
chance to thank the
NMH, al
full
Departamento de
NMH
Determinantes
team, the
Sociales,
social
al
determinants of health
Departamento de
department,
Servicios de Salud,
the Health
de la
Services
Unidad de Recursos
Department
Humanos,
at
a
the
este
Human
Salud Mental
Resources Unit,
Virtual que nos
especially the
apoya
virtual
siempre
campus that is always
y nos
supporting us
permite tener
and
este
allows us
tipo
to
de
have this
recursos
kind
como
of
Silvana
resource,
comentaba y que
as
forma
Silvana was
parte
saying,
y
and
que,
which makes
bueno,
part
aumenta
of and
la
which increases
disponibilidad
the
de
availability
propuestas educativas que
of
están en
educational
nuestro itinerario
proposals that
formativo, al
are
cual pueden
in our
acceder
training
con ese link que
schedule
le dejamos,
that
pero
you
también
can
tienen una
access with this
ventana con un
link.
botón que dice
We also
itinerarios
have a
del
window with a
campus
button that
y desde
says
nuestra página
schedule from the
web
campus
de la
and from
iniciativa
our
Mejor
webpage
Atención.
from
Bueno,
the Better Attention
lo
Initiative.
primero que queríamos compartir
The
era
first we
la
wanted to
reflexión
share
de por qué
is a
este
reflection
curso
on why
y
this
creo que
course, and
a
I
partir de toda
believe
la presentación del día de
based
hoy y
on
el otro webinario que
today's
tuvimos ayer
presentations
sobre
and the other webinar we
certificables
had, the
sociales,
second
quedan
on social
respuestas
determinants,
explicitadas,
that the
simplemente quizás
answers are made
retomo,
explicit.
digo, bueno,
I would
hablamos
merely
mucho y siempre reforzamos
recap,
la idea de
as we
que
always
las
discuss, and
enfermedades
we
no
reinforce this
transmisibles
idea
son
that
la principal
non-communicable
causa de
diseases are
muerte
the main
a nivel
cause of
mundial,
death
pero
and
lo que queremos
exploitation worldwide.
sobre lo
But
que
what we
queremos
want
enfocar y este
to
curso
focus on
y
in
esta
this
iniciativa
course
en
and this
particular es
initiative particularly is
qué le sucede a las
what
personas, qué le
happens
sucede a las
to people,
familias
what
y qué
happens
le
to
sucede
families,
a los
and what
sistemas de
happens
salud cuando
to
tienen que
health
organizarse
systems when
para
they need to organize
ofrecer y
to
dar
offer
el
and
cuidado de las
provide
personas con
care
enfermedades no transmisibles que en el
for
marco
people with
de
non-communicable
la
disease
obesidad, de la longevidad, del
that
contexto
due
actual,
to
implica que
the
van a vivir muchos
timeliness
años
and
con
the current
muchas
situation,
modificaciones
this implies that they will live for many years with
influyen no
many
solo a las
changes
personas,
that
sino a
affect
la
not
familia
only
y por
in the
supuesto
individual but the family and of course
al sistema de salud y a la
the health
economía
system
por el
and the
enorme
economy
gasto
itself by the
en
huge
salud también que
expense
implica el cuidado de todas estas,
that
la atención, ¿no? de
caring
todas estas
for all of
enfermedades.
these
Y en
diseases
esta
entails.
atención,
And in
bueno,
this
nos enfocamos
attention,
en
we
garantizar la
focus
necesidad
on
de garantizar el diagnóstico, el
guaranteeing
tratamiento, los
diagnosis,
medicamentos, la
treatment,
continuidad de
medicine,
cuidado y
continuity
también
of care,
la
and
intervención,
also
digamos, en todos estos factores de
intervention
riesgo
throughout all
que
these risk
sabemos
factors which we
que
know
influyen, inciden y
affect
aumentan la
and
prevalencia e
increase the
incidencia de estas
prevalence and
enfermedades,
incidence
como la
of these
alimentación, el
diseases,
sobrepeso,
such
el
as
consumo de
nutrition,
tabaco, de alcohol, la
overweight,
actividad
the consumption
física.
of tobacco,
Y
alcohol, and physical
claramente,
activity. And
que creo que
clearly,
no he
and I
escuchado presentaciones
believe I
más
have
claras
not
que a
heard
lo largo
more
del día de
clear
hoy,
presentations
si no
than the
intervenimos y no
ones today.
integramos
If we
dentro
do
del
not
enfoque APS
intervene
el
and
enfoque y
include
acciones
in the
concretas que puedan basarse en
PHE
evidencia
perspective
incluso,
concrete actions
bueno,
that are even
ya
evidence-based and that
digamos,
are even
presentadas, mostradas y
already
estudiadas,
presented, shown, demonstrated,
integrando
and
los
studied
determinantes
by
sociales
including
en los
social
abordajes,
determinants
la efectividad sobre las
in
intervenciones tradicionales de salud
action
como
and the
colateral
effectiveness on
en la
social,
punta del iceberg,
sorry, traditional
quedan
perspective of health
absolutamente
as
limitadas,
was shown
¿no?
the tip of the
Y en este
iceberg, they
sentido,
will remain
incorporar
absolutely
y
limited.
pensar
And
la
in this sense,
participación
including and
comunitaria
conceiving
como una
about
clave
community
para
participation as a
incorporar
key
el
to
enfoque de
include
determinantes sociales. Justamente la
the
línea 2, como
focus on
decía
social
Silvana,
determinants. This is
incluye
precisely line two, as Silvana stated,
el
which
abordaje comunitario, la
includes community engagement and the inclusion of the community from an equality perspective to reach prioritatively those populations with greater difficulties to access comprehensively the health care system. Another point is we are proposing that we need interprofessional teams. This was much discussed. When the word professional is named, perhaps this doesn't sound like a professional with a university degree. Training such as nurses, physicians, and social workers, psychologists, pharmacy workers, and biochemists. However, the training of healthcare staff proposes that all healthcare workers are included when there is a notion, a team identity, and a responsibility, and working with the community on which we have some degree of responsibility in health, and in professional teams includes decision makers, administrative workers, community health workers, and also professionals. And to achieve these teams that we need to achieve universal health, we need for there to be planning of the services of the human resources and health geared at primary care, and in the sense to have community health workers. And this is how we get to the why directly for this course. Makes so we have professional teams of professionals that are complete with a perspective geared at community health clearly by their community belonging. They provide this cultural perspective that was mentioned in the different experiences that improve access and also provide more flexibility to all actions that perhaps are so normative and so clinical, but if they are not tailored to life conditions and social determinants of health in the community, they will not have effectiveness. Community health workers have the chance and the capability to gear all of these services or tailor them to the real health needs of individuals. The purpose of this course is precisely to strengthen the capabilities of these community health workers in comprehensive care of people with non-communicable disease and the risk factors under social determinants of health in order to expand effective coverage, access to diagnosis, continuity and coordination of care, adhesion to treatment, support to self-management to prevent chronic complications, and to contribute to improving their life conditions. So high expectations that obviously we don't expect for health workers to do this alone, but for them to be part of these interprofessional teams that are planned in such a way that they can guarantee a model of work and a model of attention that makes so the effort is not alone and there are no individual responsibilities, neither within health teams. Well, our course is designed in 4 modules. The first is focused on the role of the community health worker and their skills. These skills are based on the World Manual of Community Health Worker Skills that also stems from skills for health teams to achieve universal health. And these skills are framed in what Pilar was presenting regarding what are the actors that we need for a focus based on social determinants, considering local governments, and also what are the drivers of change, including intersectorial action and community participation. So this first module is an introduction and it poses how later all those capacities, actors, and those resources, also community assets, will help us for interventions that are more focused specifically on non-communicable diseases and risk factors, stem from all these central concepts that we have been discussing throughout this seminar. The second module poses 7 activities of universal practice for the promotion of health and the continuity of care and the participation of community. And it is based also on these universal actions that propose in the Manual of Community Workers Worldwide of WHO and the operational framework also presented today by Pilar for the inclusion of determinants, the promotion of health with equity in community engagement. Each of these 7 practices that we are proposing have a guide and are geared at these 3 categories for promotion of health, for continuity and coordination of care, and for promoting and supporting the community
enfoca
The fourth
en los
module
factores de
is
riesgo,
focused on risk factors:
alimentación saludable, sobrepeso,
healthy
obesidad,
nutrition, overweight,
actividad física,
obesity, physical
consumo de
activity,
tabaco y
and
de alcohol,
tobacco and
siempre
alcohol
con
consumption,
conocimientos y
always with knowledge and
recomendaciones basadas en la evidencia,
recommendations based
orientadas
on
a partes del
evidence
trabajo de
geared
salud
at the
comunitaria.
role of
Y lo
community
mismo
health
en el
workers.
cuarto.
And
Este
the same
cuarto
in the
está
fourth.
dividido
This
en cuatro
fourth one is split
elecciones. La
into
primera
four
presenta
elections
el
options.
abordaje de
The
los
first
enfermedades
presents
cardiovasculares basados en la
tackling
iniciativa
cardiovascular
HEART.
disease based on the
El
heart
la
initiative.
segunda lección está
The
basada
second lesson is based
en el
on
abordaje de la diabetes. La tercera lección se
addressing
trata del
diabetes. The
abordaje de
third
las
lesson
enfermedades
is about
respiratorias crónicas,
addressing
asma y
chronic
EPOC.
respiratory
Y
disease,
la cuarta lección
asthma and COPD. And
habla
the fourth
del
lesson
abordaje del
speaks
cáncer,
of
siempre
tackling
desde el
cancer,
rol del
always from
trabajador de
the
salud
role of the health
comunitario.
worker in the
Bueno,
community.
respecto a los destinatarios,
Regarding
son miembros del equipo que estén
targets, these are members
vinculados
of the
a
team
acción
who
áreas de
are
tareas en la comunidad y atención personas con
leading
enfermedades no
duties in
transmisibles,
the
miembros de la
community and
comunidad con
deal
capacidad de
with people with
formarse
non-communicable
para
disease,
brindar
members of
cuidados
the
a la
community trained
comunidad,
to provide care to the
enfermedades no
community,
transmisibles,
and
líderes
non-communicable
comunitarios,
disease, community
y
leaders.
ya vamos a discutir un poquito
And
más,
we will
ya
be
estamos
discussing a bit
cerrando,
further, wrapping up,
cómo pensamos
how
esta adaptación a
we
nivel local, ¿no?
conceived this adaptation at the
La
local
modalidad,
level.
bueno, como los
The
cursos de campus,
modality, as with campus
es un
courses,
curso de
is a
autoaprendizaje
course of
gratuito, abierto al
self-learning for
público, y si
free,
en
open to
caso
the
para
public, and
completarlo, está
with a
pensado
case
para
to
que
be
cada uno
completed. It is
alineemos
conceived so that
nuestros
everyone
tiempos. Tiene
can
lecciones
handle their own
flexibles, recursos
time. It has
didácticos.
free options,
Hemos
didactic
tratado
resources.
con el diseñador que hemos
We tried with
trabajado
the designer that we
mucho
worked
para
with
poder
much in
hacerlo lo
order
más
to
accesible,
do
lo
it
más
the most
amigable, con
accessible, friendly,
actividades.
and possible
Y bueno, tiene
with
una
activities, and it
compañera
has
trabajadora de salud comunitaria
a
que la va a ir,
community health
tutora,
worker
que va a
colleague that
ir
will serve as a
caminando en la
tutor and who
comunidad,
will be
recorriendo
walking the
con su grupo de
community through
estudiantes y
with their
compartiendo diferentes
cohort of
experiencias de
students and sharing different
aprendizajes
experiences
ahí
and
en el
learnings
territorio donde
there
los
in the
procesos
territory
de
where
salud suceden,
things
¿no? Y la
happen.
vida. Y la certificación y la
And
evaluación, bueno, se evalúa
certification
una
and
evaluación
assessment. There is an
algunas
assessment.
actividades
There are
en
some
los módulos, pero
activities within
también hay
modules,
que
but
aprobar un
also
cuestionario final con el
one must pass a
70%, tiene
final
varios
quiz,
intentos, digamos, para que también
70%
funcione
approval with
como
any attempt,
una
so it
manera
also
de
serves as a
aprender,
way
¿no? De la
to learn
evaluación formativa.
the
Y
assessment of
también está la
training,
encuesta de calidad del
and it
campus, y
has
se van
a
a
quality
certificar
survey
20
for the
horas por el
campus, and
campo
20 hours will be
virtual de salud
certified
pública
via
de la
the
Organización
Public Health
Panamericana de
Campus
la
from the
Salud.
Pan American Health Organization.
Y por último,
And lastly,
se trabó, a ver si la puedo compartir. Bueno,
let's see if I can
lo
share.
voy a decir y no lo voy a compartir.
So I will say it, but I will not share it. We
Queremos
want
proponerles
to
que
propose
este
to
curso no
you
sea un
for the
recurso final,
scholars not to
sino
be
que
a
sea un
final
recurso
one,
intermedio,
but for it to be an
para que
intermediate
cada
resource,
comunidad, cada país, cada
so that
provincia,
every
cada municipio y cada
community,
territorio
municipality,
pueda
province, and
producirle
territory
sentido
can
en el contexto
produce
del sistema de
sense
salud
in the
local. No
context
en
of the
todos los
local
sistemas
health
de
system,
salud
not
hay
in all
trabajadores
health
comunitarios.
systems,
Pueden
community
ver alguna
workers.
pregunta o comentario en el chat.
There were some questions via
Tienen
the
el
chat,
mismo
have the same
nivel, digamos, de vínculo
level
formal
of
o no formal con
formal
el sistema
link
de
or
salud,
non-formal with the health
competencias
system,
distribuidas la
skills
reglamentación del
distributed by
ejercicio
the
profesional,
regulation of
distinta
the
distribución,
professional practice, different
sistemas de contratación o
distribution,
no
different
contratacionales.
hiring or
Entonces,
non-hiring systems.
este curso es una
So
herramienta
this
para
course
que
is a tool
cada equipo,
for
cada
every
planificador
team
pueda
planner
tomarlo
to
y
be able to
pueda
take
usarlo
it
como
and
base para
use
una
it as
segunda
a
instancia, un
basis
encuentro,
for
y
a
discutir
second
cuál es la
space and
tarea,
an
cuáles son
encounter
las
to discuss what
necesidades y
is the
cuál es el
duty and the
sentido
needs and
de
the
todo
sense
este flujo de
of all
conocimientos
this flow of
en
knowledge
el territorio local.
in the
Para
local
eso, ahora le vamos
territory.
a
For
compartir
this,
y,
we will
como
now
les
be
decía, están todas las
sharing, and as I
presentaciones,
said, we have all
van a estar en el aula.
presentations will be in the
Hay un
classroom.
documento de la OMS de planificación
There is a
que le había pedido a Alberto
WHO
que lo comparta en
document
el
for
chat, a ver
planning. I
si se
had
los
asked
comparto
Roberto
en
to
un
share it
ratito.
via the chat. Let's see if we can
Hay
have
un
it shared in
documento
a
de
while. There's a
regulación
document
y
on
de
regulation
planificación
and
para la
planning
formación y el trabajo
for
de los
training and
trabajadores de salud
working of
comunitaria,
health, community
disponible de
health
la OMS para
workers
que
available at
cada
WHO so
jurisdicción pueda
that every
utilizarlo
jurisdiction can
para poder
make
hacer
use
una
of
mejor
it
planificación. Muchísimas gracias.
for better
Bueno,
planning. Thank
muchísimas
you
gracias
very
a
much.
ti, Cintia, y
Thank you
muchísimas
so
gracias a todos
much to
ustedes.
you,
Solo para
Cynthia, and thanks
señalar
so
que
much to
el
all of
link
you.
para el
Just to point out
curso
that the
está en el
link to the
chat.
course is on the
El
chat.
curso se está haciendo
The
algunos
course
ajustes
is
ahora, así que se
suffering
va a
some
abrir el
adjustments
curso la
now, so the course will be open next week. but please get on the course if you can see, enroll to see how the landing page is like. So thank you so much to all of you. We have we're over the time allotted, but we have more on experiences in the region and outside of the region. And I would like to thank my colleagues Cynthia, Uriel, Pilar, and our panelists, the interpreters that allow this webinar in 3 languages, and all people involved in organizing this webinar. It's were truly super motivating for me, and hopefully you're also very motivated to get back to your primary care centers or your jobs to promote health in everything that you're doing. Thank you so much and have a good day.